This will be a continuation of the previous assessment that we started on the head and neck. We're going to start on the neck. We had just completed the assessment of the head and face and had spoken about the percussing of the skull and feeling for low-pitched sounds that might be indicative of hyperparathyroidism, and then also talking about the temporal regions here and actually assessing them with our stethoscope for any bruits or blowing sounds that could be indicative of a cerebral aneurysm. So let's go ahead and continue with the neck. Now this is important, and it would probably be helpful to have the patient bring out their clothing so that we can take a better look here, because one of the big things that we're looking at when we're assessing the neck is for symmetry. So upon inspecting the neck here, we're going to go ahead and check to see that both sides look the same. We're going to look at that clavicle area. We're going to look at the neck here. We're going to look to make sure we don't see any masses, nodules, edema, any scarring, anything that is abnormal. So as we can see here, everything does look good. We're going to take consideration of the parotid and submandibular glands. We're going to ask him to bring his neck up so we can see them a little bit better and be able to inspect them. That looks fine. The sternocleidomastoid muscles and the trapezius muscles, please lift your head up, making sure that those are also symmetrical as well. We're also looking at the alignment of the trachea, making sure it is midline and not deviated. We're also looking at the landmarks, the anterior and posterior triangles, and this would be when we assess the sternocleidomastoid and the trapezius muscles. We're basically checking the triangles as well, that they both come down this way, and then our anterior angles are here and our posterior angles are here. So we're palpating as well to make sure that we don't feel anything and that those are present there. We're also looking to see the fullness of the neck, making sure that we don't see any swelling there. Sometimes patients will come in with marked edema in the neck. That's indicative of something called cervical lymphadenitis. And all that is just cervical infection of the lymph nodes, a lymph tissue. Other things that we are looking for as well, other abnormalities, include any masses. Some people will have some webbing here, which is indicative of a chromosomal anomaly. Maybe some excess skin folds, unusual shortness of the neck, or maybe even some asymmetry there. We're also looking here, if you'll just turn your head, we're also looking here to make sure we don't see any jugular vein distension. That could be indicative of maybe some heart failure or some backup of blood. Also looking at the carotid artery and making sure it's not extremely prominent. And you'll see it pulsating if it is. So in this case, we don't see any of that. But in both cases, jugular vein distension and prominent carotid arteries are abnormal. Now, next we're going to go ahead, after we have inspected the patient completely in this way, we'll go ahead and continue with palpation of the neck. Now, there are 4 areas that we do need to palpate. The first is the trachea. Now, we're going to put our thumb on each side of the trachea, and we're going to assess that it is actually midline. And you can check this because you'll want to feel for the sternocleidomastoid muscle, and then you'll want to move in, and there is a little groove there on each side of the trachea that you can feel. And when you feel that, you want to make sure that each side is symmetrical, that the groove is symmetrical on both sides, that the trachea is midline and not deviated to one side. So that is one thing we can palpate. And then what we're going to go ahead and do is we're going to go ahead and ask him to lift his head up, and if you have a light that you can shine tangentially, you can do that. And in this case, we have a light here, so we can see it pretty well. We're going to ask him to swallow now. Go ahead and swallow. Now, when we swallow, you can definitely see here where the cricoid cartilage is, and right above it is your thyroid cartilage. So right beneath that, that is where you should have your thyroid gland. And here it's not prominent, and that's actually a good thing. Right in the middle here is the isthmus, thyroid isthmus portion, and you should not see any prominence there, any protrusion there. So whenever the patient swallows, all of these different cartilages move up along with the thyroid so that you're able to better see it. You can ask the patient to take a sip of water, and when he sips it and drinks it, all of those come up. Go ahead and swallow one more time. And then you can see all of those move up once again. The most prominent point is the cricoid cartilage, so that's something that you'll be able to see in all the patients. And right above that is your thyroid cartilage, and then right below the cricoid is where your thyroid would be. Now, when you palpate it, you can go ahead and palpate it with the pad of your fingers, and you should feel that it is smooth, non-tender, okay? And it should move under your finger when the patient swallows. Now go ahead and swallow again. And I could feel that move right there. So that is how you locate each of these different cartilages. Now your hyoid bone would be up higher than the thyroid. It would be around this area here. Now there is something called a tracheal tug. This is an abnormal finding, and this is something you could also assess. You could ask the patient again to extend his neck, and with your index finger and thumb on each side of the trachea, you can place it right over the thyroid isthmus, and if you feel a tug with his pulse, then you know that he is positive for a tracheal tug, and this could be indicative of an aortic aneurysm. So you would want to make sure that you assess that. Very, very important. So continuing on, we're going to go ahead and assess the lymph nodes. And there are very many. So we're going to start with the preauricular one. So we're going to go ahead and ask him to face forward once again. So we're going to go ahead and palpate the preauricular nodes first. And we're assessing for any size, shape, abnormality in consistency, mobility, or maybe even some tenderness. So we're going to go ahead and go preauricular. Then we're going to go ahead and go posterior auricular. And then we're going to go occipital here. And then also we're going to go tonsillar and submandibular. And then we're going to palpate submental here. And then we're going to go ahead and do superficial cervical. And then posterior cervical nodes. So we want to palpate all those for any masses, swelling or tenderness, anything abnormal that we may find. Also, we're going to go ahead and go down the deep cervical chain to make sure that we don't feel anything. And then the supraclavicular, okay, right above the clavicle. So we don't find anything there. We're going to go ahead and stop here. We're going to kind of continue our assessment with the next video.